This is Dr. James, and I was requested to do a video on the different types of diaper rashes that we see in babies. Mainly, what is the difference between a contact rash and a yeast rash? Well, so a diaper rash can look very similar, but a good rule of thumb with a yeast infection is it will be bright, fire engine red, and usually it will have little red dots around the edges, and these are called satellite lesions. And this is the way it spreads. It has a very raw appearance and almost can sometimes look weepy. And this is what we usually use nystatin for. If you get in a pinch and you don't have the ability to get a prescription from your doctor, you can use monostat for this, or even like Lotrimin AF in the antifungal like athlete foot section in a pinch could help. Now your contact rashes are going to be where they pee or poop all the time, and because their skin is just not used to that, they can end up with some vicious rashes. And I always tell people it's best to get ahead of these. When you have a newborn and their poop changes color and it gets to that yellow-green like seedy color, this is what's going to eat off their skin. And so the poop being against their skin because it's so wet. And then the other thing is just using your wipes. The wipes have a lot of preservatives in them. That's what keeps them from growing molds in those packages. And so trying to keep them dry, getting them changed as fast as possible, but using your diaper rash creams. And you'll have people that want to like promote one versus the other and think that one works. I don't really see the difference. I mean, Destin, A&D, Boudreaux's, I think they all work well. I think they work best as a barrier so that you're putting this on real thick so the poop can't touch their skin. As a way to treat the rash, again, they may soothe a little bit, but again, it's acting as a barrier so that more poop and more wetness can't go against that raw skin and cause it to get worse. Also, if you have one of these rashes, if you can let your baby's skin open to air so it dries up, that'll help. And a lot of times that can make a mess, so we put them on like little chucks or something like that so it helps them out. But it is sometimes hard to tell the difference between just a regular contact diaper rash and yeast. Sometimes it just requires a doctor to be able to tell the difference. A good rule of thumb is if you're at home and you're treating a diaper rash and you're using like your diaper rash creams and it's not getting better and or getting worse, it's probably time to consult your doctor and see if one, they have an extra trick to help with a contact rash, or if this is yeast and we need to go that next step and have a prescription.